I'm Dr. Ann Rainville, and I'm a gynecologist here at Physicians Regional Medical Group, and I specialize in the treatment of a full range of gynecological problems, which I will discuss briefly. Laparoscopy is the most common surgical procedure that is done by a gynecologist. What a laparoscopy is, it's an outpatient procedure, which means that you just go into the hospital the same day you have the surgery done, and then you go home the same day. It's done in what we consider a minimally invasive manner, which means that although there are incisions that are made, they are very small and do not require extensive repair. Let me go into a little bit to the laparoscopic procedure so that you can understand exactly what happens. So laparoscopy is done under general anesthesia, so you go to sleep, you don't feel anything. While you're asleep, a small incision is made right through your belly button. Through that incision is placed a long scope with a camera on the end. And that is what I use to look inside and to be able to see what's going on in the pelvis. Most commonly, two other small incisions are made, one in the right lower part of the abdomen, one in the left lower abdomen. All three of these incisions are about as big as a half an inch, no larger than that. Those other incisions in the lower part of the abdomen are actually where instruments are placed to be able to do surgery inside your pelvis, while I look at it with the camera. So in this manner, when you looking in the pelvis, I can operate on ovarian cysts, I can drain ovarian cysts, I can remove ovarian cysts, I can treat endometriosis, I can remove uterine fibroids, I can remove fallopian tubes if a woman is interested in no longer getting pregnant and wants to have permanent sterilization. So there's a whole host of things that can be done laparoscopically to take care of most benign gynecological conditions. The incisions themselves, again, are very small at the end of the procedure. When the instruments are removed, those are closed with a very simple suture that is buried under the skin, dissolves on its own. You do not need to have anything removed. So after your laparoscopy is done, you will be woken from anesthesia and brought to the recovery room, where you can expect to stay usually anywhere from 1 to 3 hours from your surgery. During that time, you will be given some IV fluids to make sure that you are well hydrated. You will continue to wake up. We'll make sure that you are comfortable in terms of any postoperative discomfort. Make sure that you don't have any nausea or vomiting. Unfortunately, this is something that can happen after having surgery, and for some reason, even in gynecological surgery, women seem to be a little bit more likely to have nausea and vomiting. So we take great pains to make sure that that doesn't happen and to make sure that you're comfortable before you go home. So that postoperative recovery time is to make sure that you are stable, you're healthy, you're able to eat and drink, and you can go to the bathroom. That's also very important, to make sure you can empty your bladder, and also that your pain is under good control. When you leave, before you actually even have your surgery, when you're seen in the office preoperatively, what I usually do is I give my patients a prescription for pain medication that you'll have at home, so that you get discharged from the hospital, from the outpatient surgery center, you go home, and your pain medication is waiting for you there. Most of the time, you will do fine with a combination of ibuprofen and Tylenol as your pain medication regimen, and we'll go over this very completely with you in terms of how best to use your pain medication and how often to give it. But also, sometimes women do need a little bit of a narcotic after their procedure. The reason for this is that the way that laparoscopy is done, we talked about the incisions and putting the instruments in, but in order for me to be able to see in the pelvis, we actually have to tip you up, kind of upside down on your head, and then fill your abdomen up with carbon dioxide. So that's to lift the abdominal wall up off of the pelvis and off of your bowel so that all I see is just the pelvis, and that prevents any injury to surrounding organs and also gives me the best visualization so that I can do the best job for you surgically. At the end of the procedure, all of that carbon dioxide that was placed in the abdominal cavity is removed, but sometimes a little bit of it can get trapped underneath your diaphragm. That's what, underneath your lungs. And that is very irritating to the diaphragm. So what it can do is it can give you a lot of shoulder and neck pain after surgery. So we haven't done anything to your shoulder. We didn't do anything to your neck. And sometimes people refer to this as, quote, gas pain, but this is not the gas pain that you can take care of by taking Gas X. This is gas pain that is from irritation from the gas, the carbon dioxide gas underneath your diaphragm, and it's like a neurological kind of toothache pain. And so that is the primary reason why women need narcotic after surgery. That toothache pain is gone within 36 to 48 hours. But again, I want to make sure my patients are comfortable and not having pain afterwards. So that's why I prescribe a short course of narcotics. But then after that, after the first day and a half, you will find that you feel remarkably better. Ibuprofen and Tylenol is all you need. And usually within 3 to 5 days, you're completely recovered.